Imagine waking up living in your own personal hell. You have an illness, say epilepsy or cancer, which prevents you from being able to perform everyday functions like eating, moving, or maybe even just sitting up. You've heard about a medicine that could alleviate almost all of these symptoms and pain that's caused by your disease, and it would enable you to live a relatively normal life. This sounds great to you, but then you find out that this drug is considered illegal, and the government bans the use or possession of this drug. If you're found in possession of it, you could possibly face jail time. This drug is marijuana, and its use for medical purposes has been a widely argued topic for decades. I personally had friends and family use medical marijuana to alleviate pain, reduce symptoms, and increase their appetites. I have personally seen the improvements that this substance provides, and I also acknowledge the fact that these family members and friends using it have been breaking the law technically. Hello everyone, I'm Becca Bean. I've decided to focus on this topic because I've seen the benefits of the substance, and I also find the opposing views to that and the reasoning behind them incredibly interesting. To make a sound decision on which side of the argument you're going to lie on, it's important to be conscious of all sides of the argument and the points of their justification. First, I'm going to talk about the side of promoting and approving the use of legalization of medical marijuana. I was really surprised when I looked at the several organizations that supported the legalization. On riot.org, the supporting organizations that were listed were extremely prominent and well respected. Some of them like the New England Journal of Medicine, the American Medical Association, the American Academy of Pediatrics, and more. With all these associations in support of the use of medical marijuana, I found out that they aren't asking for the federal government to legalize marijuana for everyone. But right now the federal government labels medical marijuana as a Schedule 1 listing, which means that it has no medical use or helpful effects. Seth Ammerman, a Stanford University clinical professor in pediatrics and a member of the American Academy of Pediatrics National Committee on Substance Abuse, explained how they don't want it straight away to support the legalization of medical marijuana, and especially for it to be made to the general public. The AAP does want, however, like many other associations, to support the change of listing medical marijuana to Schedule 2 instead of Schedule 1, which would allow the FDA to take part in conducting research for the study. If they piloted a study regarding the benefits of medical marijuana, the FDA will be able to collect its own data. And if seen as beneficial, they could implement themselves these strict standards and regulations regarding who was allowed to possess and use it. Along with several medical associations, many individuals are promoting the legalization of medical marijuana. One individual who perhaps have swayed people's opinions on whether or not medical marijuana should be legal is Paige Fiji, mother of Charlotte. Charlotte was 3 months old when she had her first seizure, and the older Charlotte got, the more seizures she was having and the more intense they were getting. By her first year, Charlotte was taking more drugs and doing more treatments than people 4 times her age. These medications only helped for a little while, and soon after she started them, the seizures had already returned. Paige and her husband Matt were at a loss of what to do for their daughter, but in November of 2000, Colorado voters approved Amendment 20, which required the state to set up a medical marijuana registry program. This vote changed their lives and gave Charlotte back hers. Here's a short clip of Charlotte and her mother and explaining how the specific strand of medical marijuana, now called Charlotte's Web, saves lives.
What if something could end your child's pain, but doctors didn't tell you about it and the law wouldn't give you access to it? Charlotte had her first seizure at 3 months and suffered relentlessly for 5 years. She has Dravet syndrome, a rare epileptic disorder with frequent severe seizures lasting hours each time. Not being able to walk, talk, drink, or eat, she had 1,200 grand mal seizures per month. Then, Charlotte's parents found 2 doctors to sign off on medical marijuana. Just after the first dose of oil drops, she had no seizures for an entire 7 days with no side effects. Now age 6, Charlotte eats, talks, and actively enjoys life thanks to the marijuana strain named after her called Charlotte's Web. Of 40 pediatric patients on Charlotte's Web, 39 of them improved dramatically enough to be off or weaning off all prescriptions. But federal drug laws prevent anyone outside of Colorado from getting it. With the upcoming 2014 election year, this new evidence may drive more petitions to legalize the sale of Charlotte's Web marijuana outside of Colorado.
With With any social or political issue, there's always controversy and opposing sides regarding the matter. Legalizing medical marijuana is no exception. I've talked a lot about the supporters of the legalization, so now it's time to address the opposition. The biggest opposition to legalization of marijuana is the federal government, particularly the Food and Drug Administration, known as the FDA. In an article published in the Charleston Gazette titled FDA Issues Rejection of Medical Marijuana, author Lou Kesson explained some arguments that the FDA provided. In a statement taken by the FDA, it noted that there are currently sound evidence that smoking marijuana is harmful. There are alternative FDA-approved medications in existence for treatment of many of the proposed uses of smoked marijuana. Disagreeing with this statement is a number of states that have passed legislation allowing marijuana use for medical purposes, but the FDA said that these measures are inconsistent with efforts to ensure that medications undergo the rigorous scientific scrutiny of the FDA approval process and are not proven safe and effective. In another article titled Legalizing Medical Marijuana, Are We Crossing the Line?, there are a few arguments provided that oppose the legalization. The first argument is that medical marijuana has a high potential for abuse. Medical marijuana is also perceived to have a gateway effect, meaning that it could lead to the usage of other serious drugs like heroin or cocaine. In a statistic provided in the article, according to drugabuse.gov, smoking marijuana can cause distorted perceptions, impaired coordination, difficulty in thinking and problem solving, and problems with learning and memory. With these facts supporting the FDA's opposition of legalizing the drugs, they definitely have a percentage of American population supporting them and behind them. In the past few minutes, I provided you an abundance of information from each side of the argument of whether or not medical marijuana should be deemed legal. It's incredibly important to become educated about different issues like this that are happening today and develop your own opinion on them. With all the information that was provided and given to you, with the different viewpoints regarding the issue of legalization of medical marijuana, it's time for you to take all of that in and form your own belief of whether or not you will support or approve the legalization.